Hi, my name is Lauren Bacchetti, and I am a patient with Takayasu's arteritis. I was diagnosed with TAK back in 2014, and then when I moved back to Minnesota in 2016, I actually became a patient of Dr. Warrington's. Dr. Warrington, thank you so much for your time today to answer some of the questions. The first question I have for you, I'm curious on your thoughts. How important is it that when a patient is diagnosed with vasculitis, that they're told exactly which form of vasculitis they have? So often I feel patients are diagnosed with just vasculitis and that's all they're told. But how important is it that they're told that they have Takayasu's, for example, and what education should go into it for that patient?
This is a topic that's of interest to patients. Of course, it's also of interest to researchers and providers in the field. And I try to explain to my patients that vasculitis, of course, is an umbrella term, meaning it's a general term, and there are many, many, many different forms of vasculitis. And sometimes there are patients where, to be honest, despite our best attempts at doing testing and so forth, sometimes that's the best we can share with our patients to say, we know you have a form of vasculitis, we have a recommended treatment plan, but again, in some situations, we're not able to narrow it down any further. Then, in many patients, if we are confident that they have a positive ANCA test and they have perhaps a biopsy and other features that go along with ANCA vasculitis, we may call it ANCA-related vasculitis. Now, within that category, so ANCA vasculitis is kind of also a group, because then within ANCA vasculitis, we have GPA, or what we used to call Wegener's disease, MPA, or microscopic polyangiitis, and EGPA, or what we used to call Church-Strauss. Now, I understand, the interest in sort of narrowing it down as much as possible and getting to a specific name. And in some ways, the names are important, perhaps when we're documenting in a medical record, or when we're providing a medication and we have to obtain prior authorization from insurance companies for medications. But I will also say that there are situations where we're not always able to distinguish GPA from MPA. And when it comes to treatment, it really doesn't matter because we treat GPA and MPA pretty much identically. And the situation is a little bit complicated because we don't always have a biopsy available so that we can narrow it down. There are some individuals, most people with GPA, for example, have a CANCA or PR3 test, but some people may have an MPO test that is positive, which we tend to associate with MPA or microscopic polyangiitis. So there's overlap. And sometimes, providers, including myself, try to explain to patients that since the treatment, whether it's GPA or MPA, is the same, it's not so important that we really, I call it GPA or MPA. And in fact, these names, as you all know, change all the time, because ultimately we want to try to understand not so much getting the name right, but making sure that we get the treatment right, and that we're able to provide recommendations to patients regarding their prognosis or their risk of relapse. For example, we know that patients who have PR3 disease tend to relapse more than patients who have MPO disease, MPO positive disease. So even though there may be overlap and the tests don't always align perfectly with the names of these diseases, we know some features that may help guide treatment and prognosis. So I would encourage, the individual who asked this question to talk more with their provider, to go into some more depth in terms of what does it really mean to them as far as the treatment program and the prognosis. I think those are more important than the actual name itself. So those are my thoughts, but it's not an easy topic and we struggle with this. Like I said, and with the changing terminology sometimes it really makes it difficult for patients.